In my practice, typically the alternatives, the easier alternatives or less invasive alternatives have been tried and failed. But really we should be looking at pain at its initiation. There's a lot of evidence to show that in some cases acute pain can be chronified, meaning if you can treat acute pain more successfully or aggressively, that the likelihood that that acute pain will transition into a chronic pain syndrome is less. So an ounce of prevention is worth a pound of cure. So treating patients earlier. Also setting expectations. We're an aging population, and even though it's 2016, we don't have a cure for everything, and there is still pain every day, despite all of our advances in imaging, diagnostics, treatment, surgery. There's always going to be pain. As a population, we need to understand that pain exists for a reason. Chronic pain is something that might require better coping skills. So one of the things that's taught to chronic pain patients is better coping skills. Being able to deal with, accept, or work around some of their chronic pain symptoms. In addition, other things that have been looked at, complementary and integrative medicine, things like acupuncture, some of the Eastern medicine treatments, herbal treatments are being integrated into a lot of practices. And in some cases, they can be effective. Meta-analyses show that the effect is not strong, but in some patients it may be worth a try. Or it may be the alternative that they can accept. There are some patients that simply won't ever accept surgery or an injection or a procedure, but they'll accept things like acupuncture or meditation or guided imagery and relaxation techniques. You brought up an interesting point. Medical cannabis is an emerging treatment for a variety of things, including chronic pain. We definitely need more research. Cannabis in general has been stigmatized by decades of recreational use and decades of legislation that makes the use of cannabis illegal. Now, we've seen, particularly in the treatment of chronic pain, there's no one medication that's perfect for everybody. Every single drug and treatment has a side effect of some sort, and we need to keep looking for the treatments that could be effective, safe, not cause interactions, or not cause side effects that are intolerable. So we see an emerging literature, emerging research on the use of medical cannabis, particularly for neuropathic pain, which is one of the more common pain syndromes that people in the United States suffer from due to our very high incidence of diabetes. Actually, the stigmatization, I think, occurs before a lot of patients get to a pain specialist. So in many practices and in many areas around the country, it's the primary care provider that's initiating opiate therapy on a patient who may or may not be a good candidate for that. And what we see time and time again is that the doses and the strengths and the potency of these opiate medications through the primary care provider's hands goes higher and higher, but the patient's function doesn't improve. When it hits the fan, if you will, then patients are referred to a pain specialist who have to take a step back and say, what is the pain problem that this patient is suffering from? And what are the other things besides opiates that we can use to treat this patient's pain and improve their function? And now we also have the added challenge of dealing with an addiction.